Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. Now, you may think that dementia only happens to people over 60, but there's a rare condition known as FTD that strikes people in their 40s and their 50s. FTD, or Frontotemporal Dementia, is a rare neurodegenerative disease among people under 60. Now, because people with this disease may act out of character or maybe display indifference, FTD is often misdiagnosed as a mental illness. Well, joining us now during World FTD Awareness Week to talk about symptoms, diagnoses, and testing is cognitive neurologist Dr. Andrea Bozoki, Division Chief and Professor of Memory and Cognitive Disorders at the University of North Carolina at Chapel Hill, and Susan Dickinson, CEO of the Association for Frontotemporal Degeneration. Their mission is to improve the quality of life of people affected by FTD. Welcome to Health Professional Radio, both Dr. Bozoki and Susan Dickinson. Thank you for joining us this morning.
Thanks for having me on. Good to be here.
Dr. Bozoki, tell us what FTD is and who's affected.
Sure. FTD is one of a group of progressive neurodegenerative disorders. This one causes primarily loss of brain cells in the front part, the frontal lobes and the temporal lobes in the brain over time. And as you mentioned in your introduction, it is more a disease of midlife than of late life. So people as young as their mid-40s, though I'd say more commonly, people in their 50s and 60s are where you see this. And although, the disease impacts less than 60,000 people in the U.S. overall, in people under 60, it's the most common form of dementia. I just want to add here that probably your listeners are familiar that dementia is really an umbrella term. It's a description rather than a diagnosis. Mm-hmm. And so what's important to know is that dementia looks different in the different diseases. And, while memory loss is kind of the trademark first symptom of Alzheimer's disease, in FTD, that first symptom tends to be a change in somebody's behavior or personality. A little bit later, you'll see impacts on other frontal lobe functions, judgment and reasoning, planning, organization ability. And because language is also strongly in the frontal lobe, a subset of these folks develop speech and language impairment, occasionally even movement disorders.
Susan, with so many of those symptoms that can be associated with other conditions under that dementia umbrella, what are some specific red flags or symptoms of FTD?
You're right, Neil. It's a very confusing array of symptoms, and it can start as a language disorder, which would mean all of a sudden somebody has trouble putting words together in a meaningful way, or maybe they start losing the meaning of specific common words like car. If it is a more frontal presentation, we're going to see those changes in behavior or personality. So maybe somebody who's always been good at their job starts missing deadlines or displaying poor judgment, making mistakes. At home, somebody who's been a very affectionate parent or spouse may start showing lack of interest, real apathy, just has trouble getting off the couch. What we know is that, especially for healthcare providers, what can be confusing is in about half the people, one of the first symptoms is a lack of insight. So the patient themselves may not recognize that they are changing, but you're going to have an informant from the family who's telling a very different story about some very disorienting and confusing kind of changes like we've been describing. What we know is that because it is fairly uncommon, prevalence is maybe about 50 to 60,000 people in the U.S., we know that even most neurologists have not seen a case of FTD, and so it's a difficult diagnosis that on average can take people up to about 3.5 years.
Is there any information on the genetics of this disease? Is it something that can be inherited? Are there any genetic markers to determine whether or not a person is predisposed for this type of disease?
So in maybe 70% of people, the disease is what we call sporadic, which means we don't know why it occurs in the individual. But you're right, in 20 to 30%, we do see an inherited pattern. So the disease developing in grandparent to parent to child. And of course, this does signify that there's a genetic change being inherited in the family. We do recommend that anybody with the diagnosis get genetic counseling and consider being tested to see if there is one of these genetic changes that's causing the disease in their family. And that's important not just to understand the risk to family members, but today we are seeing some exciting development of clinical trials which are enrolling people with these genetic changes. And these are going to lead to the first approved drugs that are actually going to impact the disease itself, either slow it, stop it, or even prevent it in people if we can get to them early enough.
Are there any treatment options available prior to these trials and the approval of the compounds that will be tried? Are there any options? Have there been any options?
You know, I just want to be clear. While I think that it's important to be optimistic and to have hope, I don't want to mislead the audience into thinking that it's just a matter of getting, a drug through the studies and then they will be approved. Unfortunately, the hurdle is, of course, to find one that will work and be safe. So, that's the role of research. But at least we have several drugs in the pipeline that are being tested. In the meantime, we do offer some symptom treatments. So there are medications that can target some of these challenging behavioral symptoms, as well as a little bit of the cognitive decline. And I wanted to say that I also have access to a diagnostic tool called a PET scan that can help me to distinguish between forms of mental illness and actual neurodegeneration, which is a good reason to refer to a specialist these days.
Was there anything that either of you would like to add for our listeners before I ask for a web source where our listeners can go to learn more?
This is Susan. I would just add, Neil, that even though, as Dr. Bozoki says, there is no drug, that a doctor can prescribe at this point to cure or slow the disease, there are these symptomatic treatments. An accurate diagnosis also gives people access to a community across the country of professionals and family members who understand this disease and can help guide them to maintain quality of life for both the individual and for their family members, even during this time where we can't treat anything but the symptoms.
Right.
Yeah, referral to a support group is key.
I'd like to remind listeners that FTD Awareness Week is September 25th through October the 2nd.
That is correct.
That's great. Is there a website where our listeners can learn more?
Absolutely. LearnFTD.com, which has been developed by experts to cover both pre-diagnosis information and also information on genetic testing and clinical trials. LearnFTD.com.
I appreciate both of you joining us here on Health Professional Radio this morning. It's been a pleasure speaking with you. Thank you so much.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Andrea Bozoki and Susan Dickinson. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.